Hello there, welcome back to the channel again today. My name is Pharmacist Nkechi. Before I start on the topic for today, I want us to understand some basics about blood pressure. Blood pressure is as a result of both the resistance offered by the flow of blood through the arteries as well as the amount of blood that the heart pumps. When recorded with a device, it records as two different numbers. The systolic pressure, which is the pressure in the arteries when the heart beats, this is the upper number. And the diastolic pressure, which is the pressure in the arteries when the heart relaxes in between beats, this is the lower number. The normal blood pressure for a healthy person is usually in the range of 120/80 millimeters of mercury. But note it that throughout the day the blood pressure varies depending on the food you've eaten, the medications you're taking, your body position, the stress, and a lot of other factors. It is usually lowest at night and rises sharply when one wakes up. Certain conditions can cause low blood pressure. Let's look at this condition, which sets the pace for our discussion for today. So medical conditions that can cause low blood pressure includes: number 1, pregnancy. Changes in pregnancy can cause rapid expansion of the blood vessels. These changes and the subsequent expansion in blood pressure in the blood vessels will cause a drop in the blood pressure. Low blood pressure is usually common in the first 24 weeks of pregnancy, after which blood pressure returns to pre-pregnancy levels after giving birth. Number 2 is heart and heart valve conditions. Heart attack, heart failure, heart valve disease, and extremely low heart rates, also known as bradycardia. All these conditions can cause low blood pressure. Number 3, endocrine disorders. Any disease affecting the parathyroid and adrenal glands, such as Addison disease, can cause a drop in blood pressure. Also, low blood sugar, hypoglycemia, and diabetes also can cause low blood pressure. Number 4 point is dehydration. When the body doesn't have enough water, the volume of blood in the body decreases. Other conditions like fever, vomiting, severe diarrhea, long-term use of diuretics, strenuous exercise, all these can also result in dehydration in the body and likely the subsequent drop in blood pressure. 5. Blood loss. Losing lots of blood, such as happens when one has an injury or when there is an internal bleeding, can also result in a drop in blood volume, which also leads to low blood pressure. Thank you for hitting that button to watch this video, and I hope I'm just making so much sense to you as you're watching the video. Next, severe infection, also known as septicemia. When an infection enters into the body and into the bloodstream, this can cause a life-threatening drop in blood pressure, known as septic shock. Number 7, severe allergic reactions, also known as anaphylaxis. Symptoms of severe allergic reactions include sudden drop in blood pressure. Number 7, lack of nutrients in the diet. Low levels of vitamins B12, folate, and iron can make the body to produce low levels of red blood cells, which is anemia, and this can lead to low blood pressure. 9, certain medications. Some medications can cause low blood pressure as a side effect. Medications like number 1, diuretics, furosemide, hydrochlorothiazide 2, like beta blockers like atenolol, propranolol, alpha blockers like prazosin, some types of antidepressants, and some drugs used in the management of erectile dysfunction. It is important to note that the first three classes of drugs find use in the management of high blood pressure. So patients on these medications should make sure that their appointments with their doctors are regular, to make sure that there is a good control of their blood pressure and to avoid having swings in blood pressure from the high levels to low levels, which is not good. Finally, severely low blood pressure can lead to low levels of oxygen in the body, and this can damage the heart or the brain. But interestingly, all this can be prevented. All you need to do is to take your medications correctly, keep your appointments with your doctor, apply all the caution, and implement all the self-care tips that you've learned so far on your daily care. Let me know if you found value from this video. As usual, like my video if you've not done so, share my video and subscribe to my channel. Have a lovely day.